Hi, it's Jessica DaMassa with WTF Health, and joining me right now, I have a brand new startup that is just launching. This is Kash Kapadia, and he is from Anchor Health. So good to have you with us. You're the CEO and co-founder of Anchor Health. Tell us what you guys do.
So as we've been discussing, thanks for having me first off. As we've been discussing, in this conference, the consumer experience in healthcare is abysmal. So Anchor Health, quite simply, is your champion in navigating healthcare. Now, what does that mean, right? Let's break that down. So first off, the digital experience that we're providing is conversational, which means it's chat. So it's something that's fun to use. It's something you want to engage with again and again. It's something that essentially can progress you through a journey. The second
I was going to ask you. I'm going to interrupt you, and I'm going to hang on to this.
Yeah.
So I wanted to ask you, what have you guys really done that's different? And you gave me a sneak peek of the app, and it's awesome. And you guys have integrated like some best-in-class partnerships together to really bring together a fully integrated experience. So talk to me a little bit about that. What do you have on this app?
Yeah. So essentially, as I showed you, what we're doing is we're saying we're going to bring the best of healthcare to you. We're not going to send you in 20 directions. We're going to bring it right here to you in our app.
So who do you have on there?
So for example, for the different silos of healthcare, our drug discounts come from GoodRx, our health information comes from the NIH, we've got Headspace providing guided meditations. So this is our way of saying, how is it that we can create a unified experience through conversation across the silos of healthcare by bringing the best of breed solutions to work on your behalf?
I love that, and I love the fact that it addresses all of these different aspects of healthcare that people have problems with. How do I find the cheapest prescriptions? How do I find, something that helps support my mental health? How do I find an advocate, a patient advocate? And you've really united all of these together.
Yeah.
So tell me where you're at in terms of development. So this is an app, it's a chat app. Where are you guys at? Have you launched yet?
We have not launched. We're actually going to be launching very soon, right after our presentation tomorrow at launch at Health 2.0. And right after that, we're having an invitation-only launch for 500 people.
Okay.
The first 500 to sign up get our premium membership for free included. And right after that, we're going to be essentially off to the races. We've raised a small angel round. We've got a small team. And then we're going to be, here we go. Exactly.
All right. So tell me how much it is if you're not in this 500-person free trial. What is the business model around this? You're charging the membership fee? Is it monthly? Tell me a little bit about that.
That's right. We believe in a free layer. So there is going to be a robust free layer available to everybody.
Okay.
But obviously, this is a venture scale business, so there will be premium memberships as well. These can be self-paid, or they can be sponsored by an entity like an employer, for example.
All right, very cool. And you are angel funded, you said.
That's right.
So we're going to launch, we're going to see how it goes, and then what's the next step? Are you testing this out? Are you trying to get customer feedback to revise? What's the plan of attack here?
That's exactly right. I mean, right now, this is bringing the best of human and artificial intelligence to the extent we know it right now in the app. But really, nothing beats using it, and nothing beats learning from people. And if we're all about you, we're going to be learning from you. So we're going to essentially be testing the app out. We're going to be learning how people are using it. What do they really care about? What do they not care so much about? What journeys are smooth? What journeys aren't? Mm-hmm. And we're going to make it the most robust experience in healthcare navigation that you've got.
Why tackle this aspect of healthcare? I mean, it's like healthcare is bad enough. The consumer experience is oftentimes one of the things pointed to as the worst part about it. So why tackle providing this kind of wayfinding to people?
Yeah, my role just before this, I was leading digital health at Stanford. And I experienced there that even though you release your own platform, even though you've got a great platform going, healthcare is so siloed. And really, the consumer's experience doesn't begin and end in one. You really need something that can cut across the silos of healthcare. And most importantly, there's a lot of information out there, but how do you progress someone from information to a decision and then actually allow them the power to take an action based on what they've just learned? And that's really what we felt was missing in the healthcare system. There are 50 apps on a phone sometimes, and you've really got to bring that together to create a unified experience.
You often hear about patient centricity and putting the patient at the center, and it really sounds like you've done that. And in seeing the app, I mean, really, it's very patient focused.
Thank you.
I want to ask about the clinician side of this. So I understand that part of this will integrate in a medical record. You guys are, anything that uses FHIR standards, you said, can pretty much be plugged into this. But what about the clinician side of it? Is there a way for them to interact with their patients?
Yes, absolutely. So one of the things that we're doing is we're trying to facilitate access to the clinicians. And how is it that you can get the appointment that you need? And then how is it that after the visit, it isn't like, for example, with urgent care, it isn't a siloed experience. You're able to connect that back into your record, and you're able to create that entire close the loop in how you consume healthcare. So we are a consumer-oriented platform. platform, so we're not a provider platform, but at the same time, we are working with the industry, because as you can tell from the partnerships and just the approach, it's an open partnership approach. We're bringing the industry to you. And one thing, if I can touch upon the advocates that you mentioned, right? So we're partnering with Care Council, which is part of Stanford Healthcare, to provide best-in-class health advocacy for members. So there are times when digital will reach its limit, and you need a human to make sense of a bill, to help you understand a claim, to help you file an appeal. And so when we take them through the digital experience, but we also understand when is it that you need a human. And at that point, we're able to bring best-in-class patient advocates to you.
I love that. I love this whole concept. All right, everybody, you've seen it here first. This is Kash from Anchor Health, on to bigger and better things after they launch tomorrow here on the launch stage at Health 2.0. So congratulations on the launch. We'll talk to you soon, I hope. I'm Jessica DaMassa. Thanks so much for watching.